everybody. Today I want to talk about preoperative tests, what tests you may be sent for prior to surgery. I'm also going to talk about what I'm eating before my pre-op diet or liquid diet starts. And I'm also going to talk about being scared prior to surgery and haters. Again, I mean, it's unbelievable the amount of haters we find or I have encountered. So today I had my pre-ops, and they're preoperative tests that you or your surgeon sends you for prior to having your surgery. You usually have it done, the surgeons like it done before no later than 30 days prior to surgery. Now, I happen to work where I'm going to have my procedure at, so I just decided to go today. Now, I will say, don't go for your pre-ops testing prior to getting insurance approval if you're going insurance route, because it may take some time. Now, I was just approved on Friday of last week, and it took them 2 weeks to approve. Now, had I gone last week to get my pre-ops and I hadn't been approved, and for some reason it would have took them a whole month to approve me, then my surgery would have been delayed and my pre-op testing wouldn't have been valid anymore, because it has to be no more than 30 days. So I was approved last week Friday, and I decided that I would go today because it's a Tuesday. The hospital's not as busy as like a Monday. My suggestion is call and see when is their least busy time, because not that you have to have your pre-ops fasting, but I suggest that to do it fasting, because you have to do your A1C, and that's to determine your sugar levels, and it's just better sometimes to get it done while you're fasting and not while you've eaten food throughout the day. So I would call them and see what the best time is for you to have your pre-op test done. The reason saying is if you try to go to work, if you try to get your lab tests and your other tests done prior to going to work, so let's say you have to be at work at 8 and the outpatient center opens at 5:30, and you just say, I'll go there at 7 o'clock. Now, in my experience and where I work, between 5:30 and 8 o'clock, they have their surgical patients for the day coming in. Every place may be different, but in my experience, between 5:30 and 8, all patients coming in for pre-ops, or not pre-ops, for surgery that day, will be checking in during that time. Now, day of surgery, there are tests that get done as well, and I'll talk about that a little bit later. So you have all those patients coming in for surgery having their testing. So now, you as a walk-in patient for your pre-op testing, they will take the patients who are scheduled for surgery first prior to taking any type of walk-in, and it's fair. You would expect to have your surgery on time and not wait because they took someone, it shifted, and not take someone who just walked in for labs. Now, the testing that I had, or the testing that my surgeon sent me for, were blood tests, which is just general labs to check my white blood cells, red blood cells. I had to do a urine analysis, and I had a chest x-ray. Now, when you go, my suggestion is make sure you drink a lot of water. Drink water in general, because I don't know what happened, but I couldn't go in the cup. I just couldn't. I don't know. Usually as soon as I go to the restroom, I have to go, but I don't know, pee shy or something, who knows. So just make sure you drink a lot of water. Not a lot of water, but a significant amount of water, at least 30 minutes before getting your blood drawn, so like that you're able to go. When you first come in the hospital, you're going to check in, and you first have to be registered. You have to give your insurance information, and they'll verify your address and your significant other or next of kin. My suggestion would be that anyone who's bringing you or accompanying you, date of surgery, or anyone you want updated throughout your surgery, or if there's an emergency, or just to have on file, I would suggest adding that person as your person to contact in case of emergency when you see the registration rep when you go for your pre-ops. After that, then you have to wait for the lab. They'll draw your blood, and actually I also had an EKG. I think that's standard procedure. Then after the EKG, I went to the radiology and had my x-ray. Now here's where I say haters, and not really so much haters. I encountered somebody I know who did my x-ray, and as they're doing my x-ray, she tells me, "Do you have children?" And I said yes. And that was it. Normally, "Do you have children?" is